Hi, good evening. Thank you for joining us to the information session about health and safety. We really appreciate you being here, and Superintendent Mike Morris, and we have three panelists who are joining me tonight, and we really want to appreciate, this is our third since the pandemic began, I believe third session with medical experts in our community. So we're deeply appreciative. I'm deeply appreciative. I think collectively as a community, we're deeply appreciative that folks who are connected to our community here in Amherst and are knowledgeable and in many ways on the front lines of working on the pandemic, as well as other health and safety issues, are able to join us and share their expertise, experience, and wisdom with us. So I think with that, maybe I'll ask each of you to introduce yourself a bit. So Peter, would you mind starting us off by sharing a little bit about your role and where you work?
Sure. I'm Peter Everett. I am a pediatrician. I am at Northampton Area Pediatrics, Northampton and Amherst, and have lived here in the area since 2012 after coming up from DC, New York, and then DC. And so I've been a pediatrician there and live over here in Amherst with a daughter in the school system at Fort River, and really happy to be here to talk about COVID and flu and vaccinations and our kids and how to keep everybody healthy this winter.
Great. Thank you so much, Peter. Lauren, would you mind going next?
Sure. I'm Lauren Westbrook. I am an ER doctor and a researcher down at Bay State. And I have young kids that are too young to be in the school system, but my wife is a teacher at Wildwood.
Thank you so much, Lauren. And Bill?
Hi, everybody. I'm Bill Soros. I'm also an emergency physician at Bay State Medical Center. I've been practicing there since 2013. And also, we have 3 kids now in the Crocker Farm system. So, yeah, we are heavily invested, and I'm really happy here to be able to talk and hopefully answer some questions and share some information.
Thank you so much. And so just a couple of things that I'd like to go over beforehand. Some of the topics that we're going to be talking about tonight are about moving towards winter, when being outside may be less desirable for many of us, and how to stay safe during that time period. Some vaccine information, both about the flu vaccine as well as the potential of a vaccine for younger children coming up. And booster shots, which is another topic that's come up a lot in our community. I'll start by talking about an update on school cases and school safety. We'll also touch on masks and any questions folks have along the way. So as people are interested, there is a chat box at the bottom right-hand corner, and people can ask questions. I do want to note that as it relates to school-based policies, I'm happy to answer those questions. These folks don't work for the Amherst Public Schools. That'd be my job. So if there are questions about school-specific things, I'm happy to answer them. And I just ask that everyone maintain a respectful tone. As you can see from Lauren's screen, there's some young ones with us. So we want to make sure that the tone stays consistent because we know some of our students are watching with their families. So again, thank you for joining us. This will be replayed and shared in our newsletter. And on Friday, for people who can't come, also the YouTube channel, the link that you're on now can be shared. So I want to just start by talking about school-based cases. And I think the thing to note is what we've experienced this fall is consistent with what you'd expect us to experience. The beginning of the school year, late August, early September, we had a significant number of cases locally. And we had significant number of cases in school. As those numbers have went down in our community, the numbers have went down in school. So, this afternoon I put in every week in the state database, we have to put in how many new cases there were in the last week. And there are no new cases in our district this week. And that's the first week in the school year that we've had that. So, that is a little different than we've had, and some great news. But I think the thing that I want to note is that what we have found between last year when kids were in and this fall is we're over 20 cases, and we still have no evidence of school-based spread. We've had close contacts. Those close contacts have tested negative. And so we feel good that our current measures at the current time are promoting healthy, safe school environment. I am conscious that there are some folks who really wish they didn't have to wear masks to school. I think probably collectively all of us have that feeling, and whatever our workplace is, it'd be great to be unmasked from a comfort perspective, from seeing people's faces. At this point, even though at our high school level, we probably do meet the threshold of 50% or 80% of students and staff who are vaccinated, we're going to stick with the masks. Our public health department in the town has been really clear that at the current time, they believe that's the best course of action. And as we continue to have positive cases and no spread, it really does make us recognize that those mitigation strategies are being effective. That students in school, when the contact tracing is done, they're more often than not, when it's known, they're finding out that it's from a non-school-based exposure. We have no evidence, again, of a school-based exposure. So, the distancing we've maintained, the ventilation that we worked on, the universal masking, we now have Binax test available for anyone who's symptomatic and in school during the school day. Those have been measures that we've seen as being successful in our schools, and we're going to continue them at the current time. And, as public health guidance evolves, we may, evolve along with it, but there's no indication right now from our local public health department or lead nurse that we want to do anything other than maintain the course around our health and safety measures. So I just wanted to start with that kind of broad summary of what we're doing and where we are with things. And I thought maybe at this point I would turn and talk a little bit about the changing seasons. About right now, today was beautiful. This next couple of days, really gorgeous. Sadly for me, I'm not a winter lover. It's not going to stay like this. We'll be having the traditional November snow, ice, muck weather coming and not so long. And I think there's a lot of concerns I've heard in the community about being indoors more often, not just in school, but actually in general as well. And concerned about so many people have enjoyed outdoor play dates and things like that for their kids that may not be as accessible as we head towards winter. So I think I'll just turn to the panel and see if you have thoughts about, as the seasons change, what are some strategies parents can use, and some thoughts about how to maintain that safety, but also maintain that social connection that we know our students have craved and have really enjoyed as things have opened up a bit more over the last couple months. So anyone can start off and speak into that.
I mean, I guess I can start with some general statements. So as Mike said, I'm definitely not part of the ARPS system. And that being said, I really kind of admire, looking from a physician and from the standpoint of a father with 3 children, the effort that the school has made. And I think that's really shown in the data, that we really don't have school transmission. And it's based on this idea, I think, of really harm reduction, of taking multiple strategies. And I think that's really important, especially with Delta. There's not one thing that works for everything, unfortunately. Vaccines are very important, but it doesn't work for everything. Masks are very important, but it doesn't work for everything. And having multiple strategies and multiple things that you can do makes it much less likely that you're going to get COVID or it's going to spread. So right now, that has been a combination of vaccines and ventilation and masks and spacing. And I think the worry from a lot of us, as was said, is that we lose a little bit of that in the winter, mostly that idea of ventilation and going outside. So the first thing I'll say, it's just obvious, if we're losing one of those reduction strategies, we really want to make sure we strengthen those other strategies. I don't know about you, but I've been kind of lax with hand washing and other types of things. Thinking about that, thinking about, play dates and, talking with families and what are some exposures. And so I think the first thing is to make sure that some of your other efforts are just a little bit stronger as we come to those colder months where we know viruses like to propagate indoors.
Yeah, I would absolutely agree with you there, Bill. I think as the things that we can do is to do multiple things, to kind of this whole idea that if you do a number of different things, then you're more likely to reduce the transmission as we get into these colder months. It is nice outside. I think I would still, being outdoors during the winter and having outdoor play dates and all of that is still something that's really good. And even as it gets colder, finding more time to spend outside, even not just from a stop the spread of COVID perspective, but as a pediatrician, getting more kids outside and playing outside and being active and all of that is a big benefit here. And so I would still encourage that as much as you can, and get your extra layer on and be outside as much as you can. And then the other thing to remember is the social aspect too. Is just, I think you can take all these measures and wash your hands and have your masks, but I think taking that step and start, one of the big important things I think is starting to reintegrate and to connect with people again. And so finding a way to do that in a safe manner is important for our kids.
And sort of in that vein, one way that I personally found helpful in doing that social connection in a way that I feel safe, because I have very small children, as you might be able to see, I have a 8-week-old baby here, is through testing. But we test our family on a regular basis because it's free through UMass. If you're asymptomatic, you can pick up a kit, and then you can drop it off without contact whenever you want. And usually if it's not a weekend, you get test results back later that day or by the next morning. And so we do that regularly just to kind of surveil our family, because I'm an ER doctor. My wife's a teacher. And while we mask and we do all those things, our kids go to daycare. One of our kids is in a toddler classroom where they don't wear masks. So we want to make sure that if we catch something, that we can let people know as soon as possible, even if we're not feeling symptoms yet. The other thing that we do is they're a little on the expensive side. It's $7 a test, but the Buy Max Now test you can get on Walmart.com. So we bought a bunch of those because we do need to have some of those social connections. And sometimes, whether it's rainy and we plan to have people over or something, they can't always happen outside. So what we did is we had people swab themselves before they came into our house. And so it made us feel comfortable that they weren't contagious at that time. It's not a perfect test, but it's pretty good at saying, are you contagious right at this moment? And so these are those tests. It's a pack of 2 tests. And so those are just some additional ways that we feel better and that we are in our family preparing for the winter when some things may need to move sort of indoors, but also preparing for there's going to be more colds, because we're already seeing more colds in the emergency department. I'm sure Dr. Everett is as well, and things like that to help us differentiate. Is this COVID? How worried do I need to be right now before I can go to the pediatrician? Those sorts of things.
Great. Thank you. We're going to transition to other topics, but as I said, there is that chat button in the lower right-hand corner, so you don't have to wait till the end. If you do have a question, comment, or an idea, something that's working well for you, we'd love to see that too, and be able to share good ideas like you heard from our folks on the call. I thought the next thing, there's kind of 3 categories of vaccine-related questions that I know I'm getting, and I'm not an expert and I'm not a doctor or a medical doctor. And so, sort of those 3 things. One is the flu vaccine. As that's become more available, I got mine on Friday or Saturday last week, something like that. Thoughts about getting the flu vaccine, particularly this year. The second topic is around at least the hearing and the potential of the ages 5 through 11 vaccine that's being talked about, and the data's in, and it's been at least publicly reported in terms of a press release, not the literal data. Just any thoughts you have, what you're hearing about that particular topic. And the last one is for adults who are eligible for booster shots. We have a number of staff members, all of our staff members actually work in schools, would be eligible. So I think starting with the flu vaccine, I think they're all topics that people have a lot of questions about. And so I don't know if anyone wants to start with any thoughts about flu vaccine in particular as we head towards winter.
I'm more than happy to talk about flu vaccine. It's something that we, in a way, I guess, plan for every year, and this year is no different as far as getting kids and encouraging kids to get a flu vaccination. And it's recommended for anybody over the age of 6 months to get their flu vaccine. And this year, last year we didn't really see any flu at all. I think nationwide there was, just one death from influenza, which usually will have a couple of hundred per year, and we really didn't see any flu at all. But what that means for this year is we don't know. We don't know if is the unmasking that we've been doing and all this hand washing and separation going to be true this winter or not. And like, we are starting to see, other viruses, not flu yet, but other viruses coming back, RSV and other things. And so the flu vaccination is another thing that's going to be really important to help to reduce the risk of getting the flu, but also reduce the severity of it. And so it is something that we definitely recommend. It's widely available now. We've been giving flu vaccines out for the past couple of weeks. It's available, at all the hospital centers and all around. So, and the pharmacies. One of the things I sometimes hear is that, well, should I wait to get my flu vaccine, or should I get it now, or when is the most effective time to get it? And in general, my advice has always been to get it when you can get it, because a lot of times sometimes people will come in and say, well, we want to wait, we'll come back to get it. And then, you never get around to it. And so all of a sudden it becomes December, and then you start hearing about flu cases spiking, and then you have to rush around. So I generally recommend that if you're in the doctor's office and you're offered the flu vaccine, or you're in the pharmacy and they're giving you the flu vaccine, to go ahead and get it. We're really not sure what's going to happen. Like I said, with the flu season this year, is it going to be bigger or more cases or less? And so one of the best ways we know to prevent it is to get vaccinated.
I think the other thing that I've heard, and again, you all can comment on this if you like, but just is right, the flu has its own, right, it's its own illness, but also the not knowing was really hard this year, because a lot of the flu symptoms are pretty similar to COVID symptoms. And so, I think that's another thing that I'm hearing a lot in the community, is fears that if someone gets the flu, that it then triggers a whole number of other things and fears. That feels a little different than, in prior years, prior to COVID being what it is now. So I don't know if that messes with what you're hearing or concerns about, but I know from families where people are having a lot of concerns because, fever, a lot of the symptoms, might feel similar, especially to kids. So you don't have to comment on that. Just something that I know I'm hearing a lot about. But as we can certainly talk more about the flu vaccine, but I think, I am getting, of all the vaccine questions, probably because of my job, the potential of childhood vaccines, both 5 to 11, but I also know we have preschoolers in our district, and that seems like that's on a little bit slower timeline as well. And, not at all expecting you to know what's in data that's not been publicly released in all of its detail yet. But just things, questions I'm getting are, what's the dosage? Is the dosage the same as it is for the 12 plus? What would it be 2 shots, 1 shot? In terms of cost benefit of it, since students, since children in general, compared to like an elderly population, the risk factors are different for, what happens if you contract COVID. How should we think about those risks? So those are the kind of the 3 things I hear a lot about, is what's a dose, how many shots, and then how should I think about that relative to young kids? So I don't know, anyone can jump in if you'd like to weigh in on those.
Sure, happy to do so. So the FDA meets on October 26th to discuss this. Pfizer has applied for that 5 to 11. So the 12 plus already has emergency use authorization. The next step they're doing is 5 to 11, and then their trial is ongoing for 2 to 5 still. And so a lot of the data we don't have yet. It'll be uploaded to the FDA website under the meetings information, usually a couple days prior to that meeting. So unfortunately, we don't have a lot of that data yet. So the data that we do have is largely from Pfizer's press release thus far, and sort of some inferences that we can make. So with regards to the first question, the dose is lower. So they tested 3 different doses. They tested the 30 microgram dose, which is what I got back in December. So it is sort of the adult or the 12 plus dose. And then they tested lower doses as well. And what it looks like they're going forward is the lowest of those doses. So it's a third of the dose that many of us who got the Pfizer shot got for that. And it appears that it is given in a 2-dose series. Looking even at the adult doses, we know that a lot of the protection is conferred after the first dose, and then you have sort of more protection after the second dose, but it does look like they're gonna go ahead with the 2-dose series for this. And we don't know how effective it is. And to be honest, that's not what they were looking for with this, because we know it reduced cases, and we know that cases of bad COVID, we've seen them, unfortunately. We've seen them in our community amongst kids. Thankfully, they're uncommon. So they couldn't go and they couldn't look. They'd have to recruit tons and tons of trials, and we would never get this vaccine. They'd have to recruit just tens and thousands of kids into this trial, maybe 100,000. So what they looked for was they looked at the antibody levels. They wanted to see, did they achieve a good level of antibodies? But the main question they wanted to know, and they really wanted to make sure it was safe. So their primary outcomes, the main things they were looking at were really what were the adverse events, what reactions did people have, and then they also looked what was the antibody response, making sure that kids, nothing bad happened to them. We don't want that to happen, and then making sure that they are producing this immune response. And then they also looked at cases and stuff like that, but due to the fact that a lot of this happened when our case counts were really low across the United States, like in Massachusetts, we had a great early summer. There were no cases. You wouldn't expect to see a lot of those. So we don't have a lot of the data yet, but I imagine that we'll say there's a robust immune response because that's what the press release said, and that 10 microgram dose produced side effects similar to what we saw in adults in the 12 plus group, which are a certain proportion will have fever, a small proportion. A lot may be a little bit tired, but overall people handle it very well. Lastly, sorry, I'm talking a lot here. With regards to how useful is it? I already said, kids thankfully most kids don't get really, really sick from COVID. For most illnesses, right? Kids are a little more robust. It must be nice. But we do know that even the young adults, so looking at 18 to 29-year-old age range, with the primary series, so even after the first 2 doses, you would have to vaccinate just under 400 to prevent 1 hospitalization, which is insignificant, right? You look at how many 18 to 29-year-olds there are in the United States, you're saving a lot of hospitalizations with that. So with kids, the thought is you'd still be saving a lot of hospitalizations. You may be also, you're protecting them from getting ill. So that's days at school that they're not missing because they are not getting, which as a parent, I know I don't want my kids to miss daycare because they're sick. So I want them to get vaccinated also, not just for my convenience, so they don't miss school, so they're not, isolated as well. And then because you don't want to see your kids sick, and you really, really, really don't want to see your kids in the hospital. So the trade-off is less there. You have to vaccinate a lot more little kids to prevent that hospitalization. You have to vaccinate a lot of kids, but not as many kids to prevent kids from also getting a symptomatic infection, which is also, as a parent, something I care about, even if they're not super sick. And it's a lot of kids, but we have a lot of kids in that age range in the United States. So those are my general thoughts and interpretation of what I think we're going to see.
Yeah, I think that's, it's really important. And I want to emphasize kind of what Lauren said there. When we talk to folks, we hear people want to get back to their normal lives, right? And so how do we start to live with COVID? And part of that, although, it's exactly right that kids thankfully have less hospitalization, less serious disease, there are those other impacts of kids can still get sick and they can be out of school. And I will tell you, all of us will tell you on this call that our healthcare system is still stretched, right? And if you are a parent and your kid gets sick, it may be hard. It may mean if you have to go to the emergency department, you may have to wait a lot longer, or to your regular doctor, you might not be able to get that same day visit. And that puts added stress on families, that puts added stress on everyone, and it makes it so you're not back to your normal life, right? That, if your children do happen to get sick and they're out multiple days and you're not able to bring them in or get them tested. So I do think that, a lot of this, when we talk about these things, about wearing masks, about thinking about getting your children vaccinated, presumably once it's approved, it does get back to that allows us to get back to some of that normal life that we all want to have. And I think that's a really important point.
Comments are enabled. So I saw Eric has, he wrote a comment, our comments enabled. So, definitely jump in with your comment or question. The other thing that I hear a lot is in the community is concerns about long COVID, particularly with kids. So, some people are concerned about all the things that were mentioned here, but also, the potential of longer term challenges stemming from COVID, even if it doesn't involve a hospitalization or something, even worse, that it's not something that 3 days later the kid feels okay, that there are some longer term impacts. And I don't know if you've seen that in your work or just have any concerns about, long COVID, but I know it's something that, over the last couple of months, I feel like it's grown in terms of conversations, discussions, and concerns around that. So I don't know if anyone has something to share along that dimension.
Yeah, I mean, I think it's not something that we've seen a lot of. It certainly has been reported and is out there. There are other, rare things that can certainly happen in kids. Like I said, while kids generally are fine, there are certainly some serious things that can happen with COVID. We were seeing this inflammatory syndrome. We still do see it to some extent in kids. Again, personally, I don't know if you guys have seen it down there in the emergency room, but that is another reason to get vaccinated, is that even though the risk is low of getting a severe illness from COVID if you have a young child, it's certainly not zero. And it's something that having a chance of 1 in 10,000 or 1 in 100,000, it doesn't necessarily matter if it's your kid that it's happening to. And so this is one way that you can can protect against those illnesses. The things that we've been seeing so far, and we'll get more data certainly from the vaccine trials once the FDA combs through the data, and this is what they're doing. It's one of the reasons why it takes so long for these kids. I know that kids are many of them are eager to get vaccinated so they can be protected. But I think one of the reasons it takes so long for the FDA to go through it is that with kids, you really do want to make sure that it's safe. And they were going through it to really make sure that we're not going to, we're not missing anything here. And so, so I think once it comes out and we review it, it's another reason to get vaccinated. The other thing I guess I wanted to point out, another reason to think about it is just the standpoint of, even if you're in a situation where you're exposed, even if you're not necessarily sick, but this is something that would help to keep kids in school as well. Because if you're exposed, you're a close contact of a case right now, you're out for 10 days and you may be feeling perfectly fine, but that's more time you're spending at home. And so being vaccinated is one way to both reduce the caseload potentially and reduce the amount of time out of school for our kids.
So there's a couple questions, and I think it's the questions asking about what percentage of positive cases at the high school were among vaccinated or unvaccinated individuals. So we've had a total of 5 cases at our high school since the start of the school year. That number is, and because those people are out for 2 weeks, it's a pretty easily identifiable group. So I can't get into the details. I apologize in terms of privacy rules. But what I can say in responding to the general question is that across our districts, elementary, middle school, high school, and Summit Academy, from last year to this year, we've seen a disproportionate number of our positive cases be unvaccinated individuals. Have we had vaccinated individuals test positive? Absolutely. Have the majority, not everyone, but the majority of those cases been mild or completely asymptomatic, oftentimes when they knew they were exposed to someone and chose to get tested, not because they had symptoms? That's true. So, I think our data matches the state data and the national data that can, quote unquote, breakthrough infections happen. Yes. Do they happen? Absolutely. Are unvaccinated individuals more likely to test positive? Our data is consistent with the state data that that's true. And are those cases in general more likely to be more serious? We've experienced the same thing as the state and national data. So we're no different, so I apologize. I can't get into specific numbers when our N size is 5. It's just too identifiable along that dimension. But, what we see, like I said at the beginning, we're seeing the same trends that we see in our community, in our state, and in our country about the differences there. And I think that there shouldn't be a surprise there. There's nothing unique about our community or our schools. At the high school, both in terms of students and staff, we're over 80% of folks vaccinated at the current time. And if you look at places I was sharing before this show, ProPublica put an article about a different community in a different part of the country and the level of outbreaks they had. And I feel very fortunate we're living here, and our schools have the vaccination rates that they do. Another question: can you share the risk of severe illness or death of healthy unvaccinated children compared to other diseases and risks like flu, West Nile, car accidents, etc.? I can leave that up if it's helpful.
Yeah, I think that's a good question. I'm not sure I have numbers off the top of my head. I mean, the risk of severe illness or death of healthy unvaccinated children, it's really low. I think if you're looking at, I guess I don't have the numbers right off the top of my head, but compared to other disease and risks, the issue with healthy unvaccinated kids and COVID, I think it's multiple factors about why you would want to get vaccinated. But I think that the flu and RSV and several of these other viral illnesses in kids is something that as a pediatrician, I'm actually a little more worried about from a kid perspective than necessarily kids getting COVID. But so from that standpoint, the COVID as a risk to the kids themselves is lower than some of those other things. But if we can kind of take a approach to reduce the risk of all of those other viruses, we're going to be able to take the pressure off of the emergency rooms and the pressure off the hospitals, and keep kids in schools. So but I think since we so I guess overall the risk to the kids who are not vaccinated, is low overall. So I guess I'm not sure what if that answers the question or if it gets to what the questioners.
Just to check, sorry if I interrupted, there's a little delay here. I don't know what the intent of this question is, but reading it a couple ways is the risk is really low, right? For severe illness or death. A lot of it in the younger group is about protecting those around them, but also ensuring that they can continue to go to school and things like that. And then protecting the rare complications, because we don't want our young kids getting the inflammatory syndrome or things like that. The other thing is I look at the comparisons, and it's hard to know here because it depends on whether you're talking about the risk of severe disease of flu in somebody who's vaccinated against the flu or not vaccinated against the flu, or car accidents, the risk of being in a death in a car accident, they're wearing a seatbelt or not. So, looking at the comparisons here, I look at these are great examples of other things where there are significant public health measures that have reduced the severity of all of these things. So looking at, as somebody who's trained, has a master's in public health, I look at this and I'm like, flu, we have amazing public health stuff, washing hands, staying home when you're sick, and flu shots. And for West Nile, it's, again, being aware of mosquitoes. I'm from the South, so like DEET everywhere. And for car accidents, it's, the seat belts, the booster seats, the 5-point harnesses until my children go to college, or I guess until they grow out of the 5-point harnesses. But yeah, the thing with COVID is it's very, very low. But as a parent or as a doctor, I feel really bad every time I take care of one of those patients who they are 21 and their risk is really low, but they were unvaccinated and it was preventable. And those are the really, really sad cases.
And to add on to that a bit, I think a couple of things. I think first, we have to bring up the public health because we have Delta, right? And part of the reason we have Delta is for many reasons we couldn't vaccinate and lower the transmission, right? Mutations happen when you have unchecked transmission, right? That's how these viruses work when it spreads kind of like wildfire. Even if it spreads in folks that don't get too sick, you can start to get mutations that cause Delta. And all of a sudden, Delta changed the game. Right? Whereas initially vaccines seem to prevent even illness, because of that high replication rate, it changed. So I do think part of it and part of that consideration of folks is we really overall, as a community, as a nation, as a globe, want to get the rates down so it is less likely to turn into whatever the next variant is going to be. And the other that I would say, I totally agree. But like I think all of us as clinicians, it's not just about the one risk, it's weighing the risk and the benefit, or the risk of the disease versus the risk of the treatment. And in all of those things, my understanding, and I don't know the 5 to 11 data, but all other data sets, the risk of this vaccine is pretty much as close to zero as we can get, right? The risk of dying from this vaccine is zero. The risk of having a severe reaction is, one in hundreds of thousands to one in millions, numbers that we can't even comprehend. So I think when something continues to prove to be that safe, and we do want it to be proven to be safe, that's why we're waiting for the data and waiting for the FDA. But if it comes out that, yep, it's the same and there really aren't downsides to that, then it doesn't take as much for me to say, you know what, I know the risk of severe disease for my kid is really low, but the risk of this vaccine is really, really, really low. And there's other things that this can help. So it's I think, weighing that aspect.
Thank you. That's really helpful and a good question. And I think, choices that families have to have the data to be able to make for their children. Here's another one. Are outdoor play dates on mask, no distancing still considered safe as we did over the summer? I can speak to that from the school perspective, and then certainly you can jump in. It's a question I've gotten quite a bit this fall. It's interesting seeing our recess. We based on, and I'll explain in a second, the guidance we've gotten both from state CDC, but also from our local public health authority. We're continuing that practice of not masking at recess. And that's because what we're seeing in the community is we're not seeing spread from those scenarios. I think if that changes, we'll change our strategy. But I know a number of people emailed me right when school was opening, and I talked to the Amherst health director, said, let me know. And she's like, well, you're not going to have 5,000 students, convening on the same site for hours on end being, static. And I said, no, that's not, our schools aren't that big and kids move around. And she expressed that that's not, when they did the contact tracing of the cases, that's not where they were seeing the spread. So for us at Learning Ways at Recess at school, we've maintained that. It's interesting that, I'm at the elementary schools every week. I would say about 50% of kids are continuing to be masked. They're choosing to be masked at recess, and we would support them in the choice that they and their families make. And about 50% of students are taking off masks, and it ranges based on kind of factors that are known, age level, right? So we see a little different behavior in kindergarten, first grade than we see in 5th and 6th grade at the elementary level. And then some of it's just, random factors of who's choosing to wear that. So I think just wanted to share at least our perspective of why we've made the choice we've made at the school. And again, if the public health director sees different trends in our community, we'll be making different choices around that topic. But, in terms of outside the community and play dates, I open it up to the rest of you if you wanted to jump in.
Yeah, I was just going to say, I think it's generally okay. I mean, the number of cases that are being transmitted outdoors is really, really low. I mean, I think, so from that standpoint, yes, play dates, particularly if you're talking about, small numbers of people outside, I think the risk of transmitting COVID in that situation is going to be extraordinarily low. I mean, certainly if you have, it's large groups of, people you don't know in indoor, outdoor situations, and you're there for a long time, then you may want to rethink that. If you're in a different situation as well, where you've got, a lot of unvaccinated people in the household, or you're not sure, people you don't know, then masking, makes some sense. But certainly outdoor play days, if it's going to get more kids outdoors and active and playing and being able to socialize, then I think in general that's fine.
Yeah, I think the other thing I'll just add quickly on that topic is they're also, we're talking about young kids here, and there's a wide variance in risk in mask tolerance for long periods of time. So when we think about recess and we think about school starts the elementary kids, a little after 8 and ends at 2:35, whatever it is. That's a long day, other than, meals to be masked. And for some students, what I would say for all students, the safest place to take a mask break is outside. And so, we want to balance those needs of students to have that mask break, to socialize. And for some students, it does matter that their mask is off around socialization for a whole host of reasons. So, I think there's a different comfort levels for kids, for families. And that's why we see, the range that I described of masking outside at recess. and we want to support kids and families in the choices they make in that environment while we're not at the point of really considering anything but a universal mask mandate inside at the current time. Lauren, Bill, anything you want to add to that? Yeah, please.
Yeah, just a quick sort of looking at this question from a research lens. Absolutely, could a case happen from an outdoor play date with how infectious Delta is? Yes. Like I don't want to sugarcoat things and say like this is never going to happen. However, that is as safe as you can get, particularly in a highly vaccinated county like we have here, or in a community where we know a lot of people are vaccinated. And so I think that looking at all the range of activities that you can do, that's the lowest. And it also depends. So if I take an 8-month-old and another 8-month-old and I put them together for an outdoor play date, they're going to lick each other. So the risk is going to be a little bit higher there than if you have 5, 7-year-olds, 14-year-olds running around playing soccer or whatever. But it's as safe as you get. And especially if you compare it to other things, we're almost 2 years into this pandemic. And what we have seen, especially in our emergency department, is a rise in mental health crises among our pediatric population, which is something that is really devastating many communities, and even people that signed up to be physicians and mental health experts, because it's really sad to see this, and a lot of it comes from the social isolation. So there are ways to protect ourselves against COVID. But COVID isn't the only thing we face, and we kind of obsess about that. But if it's going to Instagram or a social media site, or something that could be detrimental to the mental health, or playing outside unmasked, certainly I think that might be safer from a host of reasons, not just the COVID standpoint, but from thinking about how do we support the health of the children and the family and the community from sort of a more holistic, sort of whole person perspective as well.
Yeah, I really like what you said there, Lauren, and I think it's true, and we are to the point of trying to balance. I think what I feel like one of the falsities I've heard is that, right, it's the masks themselves that children, that's affecting children's psyche, and maybe for some, and I don't want to discount that, and there definitely are children where it's very hard, but I think for the majority, it's not that. It is that social isolation, and it is that more the disruption of life more than the mask. And so, having those, trying to do that kind of harm reduction standpoint of, okay, we're going to play outside, but realizing, like my children, they're going to have to come in and pee every 15 minutes. So they're going to be inside. So what am I comfortable with? Maybe they mask inside. Maybe they're not going to mask inside. Maybe that's the time where I take out my Binax kit and they're okay. And this is not, for those that haven't done it, it's not the swab into the brain. It is like a little tickle that all of my kids have tolerated. And maybe I say, look, I just want to make sure now things are okay and I don't have to worry about outside or inside. So we're just going to do a quick test and everyone is fine. And now, I don't have to care as much if you're cold and coming inside and going to play inside for a bit, maybe without your mask, and you're going to have a snack. So I think, that's, I think, an important point is developing some of those strategies to figure out what you're going to be comfortable with when that happens. Because ultimately, for many of us, the play date outside turns into something a little bit different. And are you comfortable, and are your kids comfortable with that as well? Because I think some kids, especially as they get a bit older, start to have anxieties themselves about, what do you mean I can go in without a mask and this? So I think that's important to explain as well. So I don't think it's the actual strategies. I don't think many kids are worried about the mask itself, but explaining that to them and how they're going to be safe and what they can do is really important.
Yeah, and I guess one other thing that occurs to me, or I've been thinking about, is that, if you look back to, a couple of years ago, or 2 or 3 years ago, you would have your 8-month-old outside, crawling around and licking each other back then, and there were risks then about getting RSV or getting the flu or getting adenovirus or any of the other number of viruses you get, and our kids would get sick. And then last winter that changed, partly mainly because it was spreading so much and we didn't have a vaccine, and that virus could spread. And then a lot of people, all the reasons we wanted to stop the spread of COVID and not have sick adults and kids caused us all to go into isolation last year. Now we're at a point where, particularly in this community, and you can make this decision in your families as well, if all the adults are vaccinated in your household, those 2 8-month-olds, are going to be, the risk of COVID is going to be low. And if before you were okay saying, okay, it's important for us to have these kids playing together, and we also are now thinking more about, okay, my child doesn't have a sniffle, if they are sick, I'm going to, probably be more likely to keep them home instead of just sending them off to school or to this play date, then having them play together outdoors or getting those 8-month-olds, toddlers together is going to be, a similar risk to where it was in the before times, meaning that, yes, they may be at risk for getting something like the flu or RSV, and that's the risk we take, being out there in a social community. You do all the things you can, you vaccinate the best you can, you wash your hands the best you can, you stay home when you think that you're sick, you do you got Lauren's tests from wherever you pick them up from, and do the best you can.
Yeah, and I think I just want to comment, a lot of what was said is it's something I spent a lot of time thinking about, is what's the arc of this, right? In my job in the schools, I don't think schools are going to mask forever, right? And I know it may not end as soon as some people are hoping, and probably sooner than some other people are hoping. But at some point, I don't know what normal is and whether we want to go back to it, but I don't imagine us indefinitely masking in schools in the United States or in Amherst or in Massachusetts. Just some places that I think are looking in a week and a half, because that 80% rule the state put out on October 15th. And we're not in that category. And the public health guidance I've received locally is that we're not going to be in that category for a while, that we're more conservative on that front. But I think it is going to be a challenge of risk tolerance, how it changes and how that arc shifts over time. It's going to be an adjustment for everyone. And I think the only advice I'd give for folks is to take things slow. That, as your kids are getting more comfortable, or as more kids get vaccinated this fall, they may be really excited to try more things and be inside more with other kids. And for some kids, it's still going to feel strange. You think as a percent of their life, they've been living in this pandemic, a pretty high percentage of their life, if you're talking about 4, 5, 6, 7-year-olds. And, the excitement they have in theory may not be realized immediately. And just to give everyone some time to get acquainted with that. For us, anytime there'll be a change in health and safety protocol in the schools, we'll be sure to communicate it well before it's implemented. And I don't anticipate anything coming very soon for us. There's, in my conversations with, again, my lead nurse, Robin Supernaught, and Jennifer Brown at the town, we're not looking to demask anytime soon in this particular district, but it's not going to be indefinite. And so I think that's a hard message to share. It's something I struggle with, is saying we're not going to change now, but we will have some folks not wearing masks at some point, and perhaps even towards the end of this year, it's possible that will happen. We'll have to see how the virus tracks and the guidance I get. I make these decisions based on folks like you who are much more knowledgeable than me, and my job is to communicate and implement it with fidelity. And so we'll see how that goes, but there is an arc to this, and it's not a straight arc. It's not a linear thing where it's a straight line. If it was, thankfully, or unfortunately, we would be, if it was a straight line where we were in early July and that continued, we'd be having a different conversation tonight, but that's not where we are. But we'll just, make sure we're communicating with that. And I think just being generous with yourself and with your kids, and understanding that it's going to be a process even post-vaccination for the young kids. I think the last topic we have yet to get to that we talked about was about type of masks, which is, I think, the smallest perhaps of the topics we said we would do tonight. But I don't know if there were some thoughts that anyone has about types of masks. In the district, I know we don't allow things with, we don't allow the gator style and some of those other ones with valves. But we are open, and we've seen students wearing KN95s, KF94s. We've seen cloth masks, we see surgical masks, and sort of everything in between. And I don't know if you had thoughts to share about your recommendations or what you see, particularly as it relates to younger kids.
I think some of this might have been fueled. There was a recent study that looked at mask use in communities, and it was all at the adult level. And so there were a lot of headlines like cloth masks don't work, surgical masks. And I think that as a family, when we elect what type of mask to put on our small children, to put on ourselves for various activities, we kind of think, okay, what am I trying to achieve right here? And there are sometimes when we really want to protect ourselves because we don't know the community that we're in, or it's a risky community. For example, I needed to fly. And so when I needed to fly, even as a vaccinated person, I have unvaccinated kids, I have an elderly mother-in-law, so I wanted to wear an N95. And thankfully, supply chains are running now, so there's not this huge shortage there was at the beginning of the pandemic. So I've stocked up on like some KN95s and things like that. So it at least allowed me a little bit of mental protection, and we know that these add a little bit more protection to the user. Now, when you're looking at protecting those around you, a cloth mask is better than nothing. A surgical mask is going to be better than a cloth mask. But again, to achieve, when you have high levels of vaccination in the community, a lot of that really becomes a lot less relevant. It depends on the behavior of the community in general to determine how effective those various things are. And what the added value of a surgical mask or a cloth mask is. It may be negligible if everyone's vaccinated and doing other things. It may become more important if you are immunocompromised, if you have, a transplant or you're on medications that make you more susceptible to infections and things like that. There may be different reasons to select different levels of masks. And I know in our family, we select different kinds of masks for different reasons, whether they are off of the face a little bit more for my small child, or if they're more comfortable for me to wear at work all the time, or if it just makes me feel a little more comfortable in the situation, or maybe it really will protect me because the people around me aren't vaccinated or are sick, things like that. So that's sort of my take on where I think the evidence stands at this time, and just being realistic about what the goal is at various times and in various situations.
Yeah, I think that's a really important point. And I think it can be further subdivided, I think, into medical personnel and what we wear, like what we wear in the emergency department and how we wear it versus in the general community, and especially with kids. And I think just like Lauren said, right, for me with the kids, the most effective mask is the mask that they are wearing, right? If there's a mask that's uncomfortable, if the mask doesn't fit, then I don't care if it's a KN95 versus something else. They're not going to wear it. They're going to wear it out. They're going to pull it down their nose, and it's not going to kind of provide that protection to themselves or to others. That being said, I think, there are some things that are just false, right? So the masks that folks wear, surgical masks, things like that, they're not going to decrease your oxygen. There's no evidence. They're not going to build up carbon dioxide. They're not going to malform your kid's face, right? Those are the most common things that we see for evidence against. Are there some potential behavioral things and issues? Totally. I will give that credence that some kids struggle with this, but some kids do struggle with this because of the way that it fits and the way that it feels and the way that it annoys them. So some of my kids with the cloth masks, which we still have some of the cloth masks, it would stick to their face and they would literally be eating it the whole time. And it'd be disgusting and soaked, and then they pull it down. And we found that the disposable KN95s, more for the fact that it stays off of the face a little bit, and it's much lighter, it's much more comfortable, and they're able to keep it on. And I tell you, it comes back a lot less dirty. So I think it's about finding what is right. And there's a lot of different masks right now. With regards, and this is the last thing I'll say with it, with regards to the 95, the KN95, the N95, I would be a little bit careful. The idea of those masks for us in the hospital is that we've been fitted for specific N95s that actually seal to our face, because the N95 loses its N95 capacity if air is getting in through cracks. Right? And there have been a lot of false things on YouTube where they're saying this doesn't work. It's because it's not fitting them, because they're not wearing it properly. We don't expect kids to wear an N95 properly. So to think, well, I have to use an N95 for my child, it really depends, and it depends on their fit. And if it doesn't fit them, a surgical mask or a cloth mask might be even better. So I think keeping that in mind, that especially with kids, having something that makes them feel comfortable and fits well, no matter what it is going to help.
Thank you. So we are just about at our time. So I'll give another minute or two to see if anyone has any additional thoughts, questions, comments, or tips for us here tonight. But I don't know if there was any kind of final thoughts, other things that any of our panelists wanted to share before we head off and let Lauren be with her little one. Thank you very much for joining, particularly with that additional friend with us tonight. But anything, Peter, anything else you want to share from the pediatrician's point of view for folks, for families?
No, I mean, I think, it's been a hard year and a half for everybody for a lot of reasons. And I guess I'm starting to see people get out more and having the prospect of these vaccines coming out for the younger kids and for my daughter is great and really important. I guess the thought would be just that the biggest thing that we're seeing actually now in the office, the pediatric office, apart from it, we're starting to see some more viruses, but it is, I think Bill alluded to it before, was just the amount of just mental health stress that's going on with particularly with our teenagers, but also with everyone around. And I think we sense that. And so I think that's something that we're really working on a lot. And our office is trying to reach out to our teams and making sure that they're feeling heard and supported. And I guess I would just ask everyone to just take some deep breaths and to continue to be kind and show some grace to everyone. Wearing a mask, not wearing a mask, whatever it is just to be kind when you can, because I think that's going to go a long way toward helping us come out of this pandemic. Is that piece when we're doing all the other parts, the hand washing and the masks, but also just talking to one another and listening to one another is going to go a long way. So I appreciate actually, Mike, you in putting these talks together and getting information out there so that we can be talking to one another. It's good to be here and to be talking with Lauren, with Bill about all these things. So I appreciate that.
Thank you for your participation and what you bring to it. Thanks, Peter. Lauren, Bill, any kind of final remarks you'd like to make?
I'll leave you for last, Lauren. Save the best for last. No, I agree. And I really commend the community because we are where we are with our relatively low number of cases because of all the work people have done. So I do think, this winter is different than last winter. And we are going to be able to let our kids enjoy it and have some of that life. And I would say for those of us that really want to push through that finish line, it is getting folks that are unvaccinated vaccinated. We can talk about things. We can talk about boosters. We can talk about types of masks. But if we're looking at, we really want to make the impact, even though we're at a relatively high percentage, kicking that percentage up even more is going to make that extra difference. And that's COVID, that's flu. The more that our unvaccinated can become vaccinated, the more we will be able to loosen those restrictions and kind of get back to normal. So now's the time to make that final push. And thank you, everybody.
I just agree on that. I think that the vaccines have really been a game changer, and we can obsess and talk about the minutia about breakthrough infections and things like that. But the thing is that if you look at almost all of the people that are in the ICUs and in the hospitals, they're nearly all unvaccinated, and they have that chance to protect them and their family. And it's not too late for the people that haven't been vaccinated yet. Right? That opportunity exists. There are plenty of vaccines. We're fortunate in this country. And then there are other ways. So like my children aren't old enough to get vaccinated yet, as many of the children in the public school systems aren't yet. But we live in a community where there are things like free testing at University of Massachusetts, where you can do it at your house. It's a little tickle. They email you the results. And there are relatively cheap, although $7 a test. It depends on how often you test. Ways that you can kind of keep your family safe as well when the vaccine isn't an option for you due to sort of the age cutoff. So I think that we live in a community where there's a lot of resources for even the young kids as well as the vaccines. And so taking advantage of them, I think, is really important.
Great. Well, I put a link in the chat to what Dr. Westerfer is talking about and the UMass testing with the pickup kits that she referenced earlier. So if you click on that link in the chat, it'll give you all the information of how to pick it up and what happens with that. And you know, it is easy and it's also a great resource that most communities don't enjoy that level of free PCR testing that comes back, as Dr. Westerfer said, so quickly. So it is 9 o'clock, which was our end time. So we want to thank you all for coming. We will be sharing this in our newsletter, this recording. It's also, as I noted in the chat, it is a, if you click on the YouTube link that you're watching on, once we end this, it'll be immediately available and indefinitely available. So hopefully some of the things I said hold up in time, but if not, you'll be able to go back and say I was wrong. So that's okay. That's the way my life is and as a public official here. But really want to thank our three guests from the medical community. Appreciate your continued support of our community and of our school district, and hope everyone has a good, safe night. Thank you.
Thank you.